Top 20 NSH Healthcare Assistant Interview Questions and Answers. Are you preparing for an NHS Healthcare Assistant interview? In this video, we'll cover the top 20 NHS Healthcare Assistant interview questions and answers to help you stand out with confidence. Whether you're new to care or have experience, these questions reflect what real NHS interviews ask, and we'll show you how to answer them effectively. From handling patient dignity to working under pressure, we've got you covered. Watch till the end to gain the insights and tips you need to land the job. 1. Can you tell me about yourself and your experience in healthcare? I'm a compassionate individual with a strong interest in patient care and well-being. I have previous experience working in a care home, where I assisted elderly residents with daily activities, monitored health changes, and supported emotional needs. I'm certified in basic life support and have training in manual handling and infection control. I enjoy making a positive difference in people's lives and thrive in fast-paced, team-oriented environments. My ability to build trust with patients, communicate effectively, and remain calm under pressure makes me well-suited for a healthcare assistant role within the NHS. 2. Why do you want to work as a healthcare assistant with the NHS? Working as a healthcare assistant in the NHS appeals to me because of its patient-centered values, commitment to equality, and high standards of care. I want to be part of a trusted system that makes a meaningful difference in people's lives daily. The NHS offers excellent opportunities for professional development, which aligns with my career goals. I'm especially drawn to its team culture and the chance to support patients through difficult times with dignity and respect. I want to contribute my empathy, patience, and skills to help improve patient outcomes in a supportive, structured healthcare environment. 3. What do you understand about the role of a healthcare assistant? A healthcare assistant, HCA, supports nurses and other healthcare professionals in delivering hands-on care to patients. Duties include assisting with personal hygiene, mobility, feeding, taking observations, like temperature and blood pressure, maintaining cleanliness, and providing emotional support. HCAs also help with record-keeping and may assist in basic clinical tasks under supervision. The role requires compassion, patience, good communication, and the ability to work under pressure. An HCA must always uphold patient dignity, confidentiality, and safety. It's a crucial role that helps ensure patients receive consistent, quality care throughout their hospital or care facility stay. 4. How would you ensure patient dignity and confidentiality? To maintain patient dignity, I provide care respectfully and involve patients in decisions about their treatment. I ensure privacy during personal tasks by closing curtains or doors and speaking kindly and respectfully. I avoid making assumptions and treat every patient as an individual. For confidentiality, I never discuss patient details outside the care setting and only share information with authorized staff on a need-to-know basis. I follow data protection and safeguarding policies at all times. Maintaining dignity and confidentiality not only builds trust, but also aligns with NHS values and professional standards. 5. How do you handle challenging or distressed patients? When dealing with distressed patients, I remain calm, patient, and empathetic. I listen actively and validate their feelings, using a soothing tone to help de-escalate the situation. I try to understand the cause of their distress, whether it's pain, fear, confusion, or unmet needs, and respond appropriately. I always respect their personal space and dignity while ensuring safety. If necessary, I seek assistance from senior staff or a mental health professional. Building trust and using clear, reassuring communication often helps in calming the patient. Each situation is unique, so I adapt my approach while prioritizing compassionate care. 6. Describe a time when you worked under pressure. During a particularly busy shift at a care home, several residents required assistance simultaneously, and a medical emergency arose. I stayed focused, prioritized tasks, and delegated appropriately where possible. While a senior nurse attended the emergency, I ensured other residents received timely care, maintained calm communication with patients and staff, and kept clear records. By staying organized and composed, I was able to support both the emergency response and daily tasks without compromising patient care. That experience taught me the importance of teamwork, time management, and staying level-headed under pressure. 7. How do you prioritize your tasks during a busy shift? I begin by reviewing the handover notes and patient care plans to identify urgent needs, such as medication times, mobility assistance, or hygiene support. I prioritize tasks based on clinical urgency, patient comfort, and safety. I use a checklist to manage time efficiently, and I remain flexible to accommodate unexpected events like emergencies. I communicate with the team to coordinate tasks and ensure consistent care. Regularly reassessing priorities during the shift helps me stay on track while adapting to changing needs. Teamwork and clear communication are essential in maintaining smooth, patient-focused care throughout the shift. 8. How would you support patients with personal care needs? Supporting patients with personal care means helping with activities like bathing, dressing, toileting, oral hygiene, and grooming in a way that maintains their dignity and comfort. I always ask for consent before assisting and explain what I'm doing step by step to ensure they feel safe and respected. I provide privacy by closing curtains or doors and use gentle, respectful language. I also observe for any changes in skin condition or signs of discomfort and report them to the nursing staff. Personal care is not just physical. It's also an opportunity to offer emotional reassurance and build trust. 9. How do you deal with a patient refusing care? When a patient refuses care, I approach the situation calmly and respectfully. I try to understand the reason behind the refusal, whether it's discomfort, fear, or confusion, and address it sensitively. I offer reassurance and explain the importance and benefits of the care being offered. I never force a patient but may suggest trying again later. If refusal persists, I report it to a senior colleague or nurse and document the incident accurately. Respecting patient autonomy is key, but ensuring their health and safety through appropriate communication and escalation is equally important. 10. Describe a time you worked as part of a team. While working in a care home, we had a patient with complex mobility needs who required coordinated assistance. I collaborated with other HCAs and nurses to plan the best approach, including using hoists and transfer techniques. Clear communication, sharing tasks, and mutual support ensured the patient was moved safely and comfortably. We also documented the care and observed for any issues. That experience showed me how teamwork improves safety and efficiency. It highlighted the importance of listening to colleagues, respecting different roles, and working together to deliver consistent, high-quality care. 11. How do you handle emotional or difficult situations with patients or families? I remain calm, compassionate, and professional when supporting patients or families during emotional situations. I listen actively, acknowledge their feelings, and offer reassurance without making unrealistic promises. I maintain clear, empathetic communication and ensure they feel heard and respected. If needed, I involve a senior nurse or specialist such as a bereavement counselor. I understand that empathy and presence can be just as valuable as clinical support. After such interactions, I reflect on the experience and, if necessary, seek support from colleagues or supervisors to manage the emotional impact and maintain professional resilience. 12. What steps do you take to prevent infection spread? Infection prevention is vital in healthcare. I follow all standard infection control protocols, including regular and proper hand hygiene, wearing appropriate PPE, and correctly disposing of waste. I clean and disinfect equipment and patient areas according to guidelines. I ensure linen is handled and stored safely, and that isolation procedures are followed where necessary. I also stay updated with training on infection prevention and monitor for any signs of infection in patients, reporting them promptly. By being consistent and vigilant, I help maintain a safe environment for patients, staff, and visitors. 13. How do you keep accurate patient records? Accurate record keeping is essential for safe, consistent care. I document patient information clearly, promptly, and objectively using approved formats, whether paper-based or electronic. I use precise, factual language and ensure entries are dated, timed, and signed. If I observe anything unusual, I report it to the nurse and document the action taken. I understand that thorough records support clinical decision-making, legal compliance, and team communication, so I treat this responsibility with great care. 14. What would you do if you saw a colleague not following procedure? Patient safety and professionalism come first. If I saw a colleague not following procedure, I would calmly and respectfully address the issue, if appropriate, to ensure immediate safety. I would then report the concern to a supervisor or nurse in charge, following the NHS whistleblowing policy if needed. I believe in accountability and supporting a culture of continuous improvement, not blame. Everyone has a responsibility to uphold standards. Reporting helps prevent harm and promotes learning, which ultimately benefits patients and the healthcare team. I would document the incident if required and cooperate with any investigation. 15. How do you maintain professional boundaries with patients? Maintaining professional boundaries means being caring and supportive without becoming personally involved. I treat all patients with respect, empathy, and fairness while keeping interactions professional. I avoid sharing personal information, accepting gifts, or engaging in inappropriate conversations. If a patient becomes overly familiar, I gently steer the conversation back to care-related topics. I follow safeguarding and confidentiality protocols and consult with senior staff if unsure. Professional boundaries protect both the patient and healthcare worker, ensuring a trusting, ethical relationship focused on safe and respectful care. 16. How would you assist in a medical emergency? In an emergency, I stay calm and act quickly. I immediately alert the nurse or call for emergency help using the appropriate system, e.g., crash bell. I assist as directed, clearing the area, bringing emergency equipment, and reassuring the patient. I follow instructions precisely and document the event afterward. I stay with the patient if needed, offering emotional support until help arrives. I also make sure the environment is safe for staff and other patients. Regular training in CPR and emergency protocols helps me stay prepared to respond effectively in critical situations. 17. What qualities make a good healthcare assistant? A good healthcare assistant is compassionate, patient, and respectful. They must have excellent communication skills, be reliable, and work well in a team. Attention to detail, a strong work ethic, and the ability to follow procedures are essential. HCAs need emotional resilience, especially when facing distressing situations. Being organized, adaptable, and able to prioritize tasks are also key qualities. Most importantly, they must genuinely care about people's well-being and be committed to maintaining dignity and safety in all aspects of care. These qualities ensure consistent, high-quality support to patients and the wider healthcare team. 18. How do you stay motivated during long or demanding shifts? I stay motivated by focusing on the positive impact my care has on patients' lives. Seeing someone recover or feel more comfortable makes my work meaningful. I take pride in being dependable and knowing that my support is valued by both patients and the healthcare team. I also stay organized, take short breaks when possible, and maintain healthy routines outside of work to manage stress. Sharing experiences with supportive colleagues helps too, reminding myself of the bigger picture. Improving health and well-being keeps me motivated even during challenging or tiring shifts. 19. Tell us about a time you made a positive difference in someone's care. In a previous role, I cared for an elderly patient who was withdrawn and refused to eat. I took time to talk with her daily, learned her food preferences, and gently encouraged her. Over time, she opened up and we built trust. I worked with the kitchen staff to adjust her meals and monitored her intake. Eventually, her nutrition improved, and she became more engaged socially. The nurse praised my efforts, noting her improved mood and health. That experience reminded me how small, compassionate actions can lead to big positive outcomes in patient care. 20. Are you familiar with NHS values and how do you reflect them in your work? Yes, the NHS values, such as compassion, respect, commitment to quality, and working together for patients, guide my approach to care. I show compassion by listening to patients and treating them with empathy. I uphold respect by protecting dignity and ensuring inclusive, non-judgmental care. I strive for quality by following procedures, being detail-oriented, and seeking feedback. I collaborate with colleagues to provide coordinated support and always put patients first. These values are not just ideals but practical principles that shape my daily work and ensure I contribute positively to the healthcare team. Thanks for watching the top 20 NHS Healthcare Assistant interview questions and answers. We hope these answers help you feel confident and prepared for your upcoming NHS interview. Remember, showing compassion, professionalism, and a clear understanding of your role can make a lasting impression. If you found this video helpful, don't forget to like, share, and subscribe for more interview tips and career guidance. Drop a comment below if you have any questions or want us to cover other NHS roles. Best of luck with your interview, and stay focused on making a difference in patient care.